My name is Jonathan Lloyd-Jones. I'm a community pharmacist based in Wales. I want to talk to you today about how you and your team can take some simple steps which will support unpaid carers in your area. An unpaid carer is someone who cares for a family member or friend who has a physical or mental health condition, disability or addiction. There are more than 370,000 unpaid carers in Wales, and I've had a variety of experience supporting carers as a pharmacist, ranging from a 12-year-old helping to care for a sibling with complex needs, to a 92-year-old caring for their partner with dementia. Unpaid carers undertake a range of essential activities, which might include things like cooking, cleaning and other jobs around the house, providing emotional support when someone is feeling low or anxious, or maybe helping the person they care for in and out of bed, supporting with washing or going to the toilet, and storing and giving medicines. It is important that we all know about a law in Wales that gives all carers the right to information, advice and assistance through the Social Services and Wellbeing Act of 2014. If a local authority believe that a carer might have a need for support, they have a duty to offer a carer's needs assessment and to meet any eligible needs for support identified through that assessment. There are also many carers' services in place that can provide all types of information, advice and support without a carer's needs assessment. There are some common misconceptions. Some of them I had myself. For example, carers do not have to live with the person that they care for or care for a minimum number of hours to be considered a carer. These misconceptions, along with a lack of awareness, means that many carers are not aware that they are a carer or what support is available. A common example of this would be that many parents who have caring responsibility for their children with additional needs think of themselves as mum or dad, not an unpaid carer, but they are carers. They are often missed because people assume that they're just parents rather than a parent carer. As pharmacy teams, we are in a unique position to recognise unpaid carers of all ages. We're in the heart of our communities and our teams often develop supportive relationships with regular customers. The conversations you have and the professionally curious questions you ask can make a big difference to develop an understanding that they are an unpaid carer and that help is available. There are some simple steps we can take as pharmacy teams that can change people's lives. For example, identifying carers in order to provide the best service and support for their needs. Explaining the range of pharmacy services available at your pharmacy to the patient and the carer. Signposting carers to their local authority or carers services for additional support. The Carers Aware project, Carers Trust and Carers Wales have developed a simple poster that you can display in your pharmacy to encourage carers to identify themselves to you. They have also developed an electronic fact sheet for pharmacy teams to help you to signpost carers with confidence and a checklist to help ensure that your pharmacy is carer aware. It is important for us as pharmacy teams to be aware of the National Young Carers ID card scheme. These cards are a tool for young carers to discreetly share with you and your team that they are young carers. You can learn more about how you can support this scheme at carers.org/YCID. I would encourage you all to be familiar with these cards in your areas as they can vary in appearance. I recognise your challenges. Capacity is a significant challenge to supporting carers effectively. However, I would urge you and your team to consider how you can make small changes to support carers in your community using this 7-step checklist. Number 1. Ensure you are familiar with the Royal Pharmaceutical Society's guide for children collecting medicines from a pharmacy. Number 2. If you have identified a carer or a patient who is supported by a carer, log this information on your patient medication record. This will be helpful for yourself, colleagues and maybe locums working in the branch to support them adequately. Number 3. Let carers and those that they care for know about all of the services that may help them that you offer at your pharmacy. This may include multi-compartment compliance aids, where these are clinically appropriate, prescription deliveries, private consultations, flu vaccines, and any other services in your pharmacy or local area. Number 4, if new medications are being collected, make sure that you proactively offer carers the opportunity to ask any questions that they may have. This is especially important for young carers who may be nervous about asking. Number 5, appoint a carers lead or carers champion to take responsibility for making sure your pharmacy is carer aware and that your policies and procedures recognise and support the challenges facing unpaid carers. Number 6, promote carer awareness in your pharmacy by displaying posters and relevant information and getting involved with any local campaigns. Number 7, get in touch with your local carers service or local health board. Many local services will provide training, resources or outreach support to work either with you and your staff or directly with patients with caring responsibilities. By putting these simple measures in place, looking for clues and asking the right questions, we can make a huge difference to the lives of many carers who come into our pharmacies and whose needs might otherwise go unnoticed. Thank you for listening and making a difference for carers in your area and across Wales.